Hi everyone, I'm a new Kathiresan fertility physician and Dr. Mom, and here to educate on fertility. I often get the question on social media, what tips do you have for patients with PCOS? So I thought this would be a good video to do. So here are my 3 top tips for PCOS. What is PCOS? A common misconception is that PCOS causes ovulation dysfunction, and that is actually not the case. PCOS is the consequence of a chronic anovulatory state, and because there are many causes for ovulation dysfunction, there are many causes for PCOS. I have done a video on PCOS and I will link it here. But what happens in a normal menstrual cycle is there are a series of coordinated events between the brain, the ovary, and the uterus. And that series of coordinated events results in follicle growth and eventually ovulation. I have done a video on the normal menstrual cycle and I will link it here. In PCOS, there is a disconnect in that communication between the brain and the ovary. And so what happens is there is more of a steady state hormonal production. What results is follicle growth dysfunction and ovulation dysfunction. PCOS is also characterized by high androgen levels and insulin resistance. The most common way to diagnose PCOS is with something called the Rotterdam criteria, where you have to meet 2 out of 3 of the following. The first is irregular cycles. The second is elevated androgen levels, and that can be clinically or on blood work. The third is having polycystic ovaries on ultrasound. The other thing that's important when you're diagnosing PCOS, in addition to having 2 out of the 3 of those, is also ruling out other conditions that can look like PCOS. For example, thyroid dysfunction, prolactin dysfunction, other states of androgen excess. Those things need to be ruled out in order to meet the diagnosis for PCOS. Now let's talk about the diagnostic criteria in a little bit more detail. The first is irregular cycles. So what are irregular cycles? Normal cycles come every 21 to 35 days. So if you're falling in that interval, that's considered normal. If you're falling outside that interval, it's considered irregular. Most commonly, PCOS patients have periods that don't come that often or no periods at all, but any sort of irregularity can still meet the diagnosis for PCOS. The second is the elevated androgen. So some of the clinical features are acne, irregular hair growth, alopecia, which is male pattern balding. On blood work, elevated androgens can be high testosterone level or high DHEAS. The third is polycystic ovaries on ultrasound. So this is an average of 12 or more follicles on the ovary that are small, measuring 2 to 9 millimeters in size. Now let's get to the tips. Tip number 1, you do not have to wait to see a physician. If you're under the age of 35, you do not have to try for 1 year before seeing us. If you're over the age of 35, you do not have to try for 6 months before seeing us. The reason is cycles being irregular is likely indicative of ovulation dysfunction. And it could mean that ovulation is not happening, or it could be happening and more sporadic. And it's just going to be more challenging to know when to have intercourse so that you're maximizing your chances. So seeing a physician can help. We can give medications to help make sure that patients are ovulating, and so that they know also when the right time is to have intercourse, so you can maximize your chances of success. Tip number 2, studies have shown that only a 5 to 10% weight loss has been shown to sometimes restore ovulation. So this is why physicians will often recommend lifestyle changes as the first-line treatment for PCOS. So working on diet and trying to decrease calorie intake and working on exercise. Tip number 3, fertility treatments can help. The most common cause for infertility in PCOS patients is ovulation dysfunction. And so the way we treat that is with medications such as Clomid or letrozole. And letrozole is actually considered the first-line option. Sometimes patients can be resistant to these medicines, and we can add steroids, we can add metformin. Sometimes we'll go up a level to injectable medications. If these options don't work, then IVF is also an option. That is it for this video. I hope you found it helpful. If you did, I hope you'll give the video a like. Don't forget to subscribe down below. If you have comments or questions, you can leave them for me there also. Thank you again so much for watching, and see you in the next video.